Guys, welcome back to Medical Coding with Blue. Today's episode is all about advice for starting in a new medical coding specialty. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So if this is your first job in medical coding, or if you have been coding for a while and they're moving you to a specialty clinic, like say, for example, orthopedics or cardiology, right? And they say, okay, well, we're going to put you into this clinic. Have fun. We're going to give you a couple weeks to get a ramp up period. A ramp up means that you start from nothing and then you get to your productivity and your accuracy in a couple of weeks. So the thing about it is, don't panic. Okay, don't panic. If you think, oh my gosh, I'm supposed to do this in a couple of weeks. If you know how to do your research, this is going to be very easy. And I'm going to explain this to you guys so there's no excuse, basically, right? So the first thing that you want to do when you are getting assigned a new specialty or you're starting in a specialty clinic, if it's in the outpatient setting, this applies to the outpatient setting. It can apply to the inpatient setting as well, but inpatient, you're usually seeing everything, okay? So let's just talk about outpatient for right now for simplicity purposes, okay? Let's just say, for example, they're putting you in the cardiology clinic, okay? So what you want to do is you want to get to your guidelines. If you do not have a current year ICD-10-CM code book, you can certainly go online to Google and you can Google ICD-10-CM official guidelines for coding and reporting 2025, right? Because we're in 2025. And then you can download them for free. You can go to the chapter specific guidelines in the guidelines for cardiology, and you can read all the things about cardiology that's there. And it's the same thing if you get assigned to like the orthopedic clinic. Orthopedics is going to be musculoskeletal. It's also going to be your injuries chapter and your external causes chapter. So those are the things that you're going to be looking at in the book or from the guidelines that you've downloaded. You're going to be looking at that when you first know that you're going to get into this specialty. So you need to be prepping yourself beforehand. So this means that you may have to do some study after hours, like when you're at home, so that way you can prepare yourself for when you are in that clinic. And so when you do get in the clinic, then you're not going to be lost in the sauce. Because if you have no experience in that specialty, or this is your first time in medical coding, there's going to be a lot of like eyes on you, like, okay, well, is he or she going to be able to figure this stuff out? And yes, you can. So you start off with the guidelines for that specific chapter, for that specific specialty. So you read those guidelines and you read them in their entirety. I'm not telling you to read the whole thing, although you should, but let's just start off with the basics. Read for that specific chapter. So that way you can kind of like, okay, there's going to be like this is going to be here, this is going to be covered here. If it is for like, what is it, public health or something like that, then you want to read obviously the very first chapter where it's talking about infections, okay? So you want to read that. Tie any of those things to those chapters. If you're coding for a place like family practice, or if you're coding for like the emergency department, that those two are going to see everything. so they're going to see everything. But if you know specifically, like you were not good with injuries, then you want to go ahead and look at those injuries, because injuries are seen in family practice and they are seen in the emergency department. So that's something that you want to start off with. Look at all the things that could possibly be seen in those particular specialties. If it's women's health, you're going to be looking at mother baby, that kind of thing. Those are the things that you're going to want to look over in those chapters first. So read those chapter specific guidelines first, because that is going to set you up for success. A lot of people will talk about, well, I don't know about the sequencing, and I don't know about this, I don't know about that. And these are basic guidelines questions. So that's why I'm saying, if you start there, then you're laying a good foundation for the rest of your learning for this particular specialty, okay? So that's what you're going to do first. Now, the next step is, if you have the Optum ICD-10-CM Expert for Physicians, the hospital's version also has this as well, but I love the Expert for Physicians. So if you have that book, at the beginning of every single chapter, there are examples of the coding for that specific chapter. So let's just say, for instance, you're going to go into a cardio clinic. You would go to the cardio chapter, and then you would look at the examples of how they code it. So they give you the question, they give you the answer, and then they give you the rationale. You can always cover up the answers and the rationale and then try to figure out the question on your own. So that way you can identify where the holes are in your own coding, okay? Especially if you haven't been coding in a while or if you've never coded before, okay? So that's where you want to get that practice in, okay? So to get those diagnoses down and understand those types of things, okay? That's that first part. Then you got to do this for CPT. It's the same thing, but you're going to go to that chapter specific for those types of procedures. So again, if you're in the orthopedic clinic, you're going to go to the musculoskeletal, the 20,000 series in your CPT book, okay? And it's the same thing if you're coding for podiatry, okay? That chapter, the 20,000 series, covers that as well. But also, podiatry also covers some of the skin procedures as well. So in the 10,000 chapter, into the integumentary system chapter, there's going to be some in there for podiatry as well. So that's the two chapters you want to look up for that specific specialty. So if you're working in orthopedics, it's the 20,000 series. If you're working in podiatry, it's the 20,000 series plus the 10,000 series, okay? Integumentary system, because they're doing things with the feet, right? Warts and whatever. So you want to look at that chapter. When I say to look at the chapter, what I mean is you're going to literally go to that chapter, like say for example for orthopedics, it's the 20,000 series chapter. You're going to open up your CPT book. You're going to look at all of the procedures that are available in that chapter for that series, because that's going to let you know, even if you are coding for the clinic, you're not coding for same-day surgery. Same-day surgery is something completely different. That's usually another coder that does it. Sometimes it's the orthopedic coder that does it. It really all depends on your facility. But most times when you're working in a clinic, like in a hospital or like a doctor's outpatient office, whatever, only because I try to encourage people to stick with the hospitals because you'll have more opportunity there than working in a private doctor's office, because it's an episode for another time. But when you go and you're looking at like the 20,000 series chapter, then it's telling you all of the procedures that happen under the 20,000 series. So even though you're coding for the clinic and you're doing like the evaluation and management for the office outpatient visits, right, and that kind of thing, or maybe you're coding for the professional fee side when the provider has to go up to the floor and they're visiting with the patient. So you see 99221, 222, 223, and then you have the subsequent, and you have your discharge codes. So either one of those, right? But you're working in the clinic, right? So you're looking at all of these different procedures that could happen, like that they have to go to the OR for. You're going to understand what it is. It's not going to be like, oh my gosh, I don't understand what this is. What is an ORIF, an open reduction internal fixation? What is that? You know, like if you're coding for podiatry and they're having a hammer toe repair, you know what I mean? What is a chevron? You know what I mean? Like, what is that? So you're going to understand what that is because you've already looked at all the procedures that happen there. Even though you may not be coding for those procedures, you're still going to understand, and it's still going to register. Because at the same time that you may not be coding for these surgeries that happen up in the OR, and that you're just coding for the clinic, they're still going to be documenting, I performed an open reduction internal fixation, or I performed an ORIF for whatever fracture, you know, or the podiatrist is going to say, I performed, you know, a hammer toe repair or a bunionectomy. You're going to understand what that is because you've already looked at that chapter and you've looked at all of the different procedures that could happen for that chapter. You see? So that's laying down a good foundation, because even though you don't code for it, it doesn't mean that you can't know what it is. Okay? So there's that part right there. So look at all those procedures that are available there. If you know that you're also going to be applying the evaluation and management codes, because if you're coding for the clinic, you're going to be applying those office outpatient E&M visits. And sometimes they say, well, no, the provider's already selecting those, so you don't have to worry about those. You, as the coder, have an ethical responsibility to make sure that those codes are correct. If they are not correct, you are ethically bound to speak up and say, wait a second, there's something this is missing here, this is not right here, these levels are too high and it should be this. You need to have your proof. So in order to have that, you also need to go over the evaluation and management section. You need to go over those office outpatient clinic visits, right? So it's 99202 to 99205 for your new patients, and 99211 to 99215 for your established patients. 99211 is basically for the nurse, right? If the nurse has to do anything. But those are those codes in that series. So read that part of the evaluation and management section of the CPT manual as well, okay? So that's very important to know. Also, know your modifiers that apply to evaluation and management codes. Now, before you say, well, Blue, no, I'm really confused about evaluation and management, and I don't understand. The thing about evaluation and management is not as hard as people make it out to be, okay? Everybody's afraid of it. It's nothing to be afraid of. It is all about leveling the provider's cognitive work. There's lots and lots of workbooks out there. The book that I recommend is in the description box below. I do have my evaluation and management study guide that is a companion to this book. So it's the Optum Evaluation and Management Coding Advisor. It is a workbook, and it is a book that you can use to help you to learn evaluation and management. I have created this 12-week study guide that follows that book. So if you want to get the study guide, just know that if you're buying the study guide from me, you have to buy the book from Optum or wherever you buy your books. But it has to be that Optum Evaluation and Management Coding Advisor book in order to follow along with the study guide that I created. So what I did was I broke down evaluation and management based on the most popular, because there's some niche evaluation and management coding in there that I skipped over, because for learning evaluation and management, there are 3 really big ones that you need to learn, and then there's other ones that of course you can learn. But of course, learning the office outpatient visits, learning about the emergency department, and learning about professional fee coding. These are very important. You know, critical care is in there as well. But the niche levels that I didn't really address was like for the nursing home and that kind of thing. So that's something that you can go over totally on your own. But this 12-week study guide that you use in companion to that, it's going to help you to learn it if you follow it, okay? So if you feel like you're struggling with the evaluation and management, there's plenty of resources online that are free, and I don't have to leave them here, okay? You guys can do your research. You know, like I said, what I'm offering is a study guide, okay? And so that's what I can give you there, because again, when I've done evaluation and management here, it just did not go well. People did not participate. So if you're not going to participate, I can't help you. I do have evaluation and management coding exercises that I post on my Patreon channel, just so everybody knows, okay? And the link, if you want to join that, is in the description box below. So with that said, you're going to go over those and know your modifiers that apply to evaluation and management levels and understand what they mean. So modifier 24, modifier 25, and modifier 57. These are all very helpful in the outpatient clinic. When you are looking at all the modifiers, though, some modifiers apply to only certain situations. For example, modifier 27 goes on evaluation and management, but only for the ER, and there's one other place that it can apply to as well. But for illustration purposes, if you're coding for the ER, you got to know about modifier 27, okay? So that's something that is extra that you would have to study, but taking the time with your CPT manual is going to really help you for that, okay? So looking at all of those procedures that are available so that you understand the language, that's going to go a long way, okay? You don't have to memorize those codes, the CPT codes, or even all of the ICD-10 CM codes, because you're going to go through that whole chapter as well for whatever specialty it is. I really like it if you have the Optum ICD-10 CM expert for physicians, because if you're looking through the chapter specific codes, right, about the diagnosis, there's going to be lots of coding tips in there as well. in between. And it's also going to give you those notes. All the books give you notes about like use additional code for, but Optum takes it a step further and they do add tips throughout, which is fantastic. Okay, so do that, read that. It's a lot of reading, but trust me, this reading is going to really get you prepared and like, okay, this is going to start to make more sense. Okay, this is what I wish that I had somebody who was already in the industry tell me when I first started. Okay, but I had to figure this stuff out on my own. So with that said, you have covered everything in the CPT book, you have covered everything in evaluation and management, and you have covered the modifiers. Okay, now going through the CPT books also going to help you to identify where the minor procedures are at as well. So like if they're performing, like in the orthopedic clinic, if they perform like an arthrocentesis, right, for like pain relief, you're going to be able to see that code in there as well. There's a for the small joint, the medium joint, and for the major joints. So know those. Okay, which brings me to my next step. Whatever specialty that you're in, you need to look at the anatomy for that particular specialty. So if it's orthopedics, obviously you're going to have to look at the musculoskeletal system. It's going to include also your muscles and your tendons. So knowing all of that and doing your research about that is going to help you, because it's going to make their wording a lot more sense. It's going to make it make sense. Supraspinatus, you're going to know what that is, right? You're going to know what the gastrocnemius muscle is. So that's very important for you to understand. So that's why studying the anatomy for whatever specialty it is very important. If you're in the cardiology clinic, then you need to go to the American Heart Association, where they have lots of diagrams on their website about the heart. It's really great to learn about the anatomy of the heart and how it all is involved and everything. Same thing with neurology. You can be looking up neurology anatomy plates and things like that to kind of help you to know where things are. It's very, very, very important to do that. Don't skip the anatomy. Okay, do not skip the anatomy, whatever you do, because people who don't understand their anatomy mess up on the coding. People who don't understand anatomy will mess up on the coding. And it doesn't matter how many years of experience you have. It does not matter if you have a credential that says that you know about auditing, for example, and you think that you know. If you don't understand anatomy, it's going to show in your auditing. Okay, so it's the same thing for coding. If you do not understand your anatomy, you will get wrong codes consistently. So make sure that you understand your anatomy. If it's a musculoskeletal, like I said, you're going to look at the bones, you're going to look at the muscles, you're going to look at the tendons. If you're coding for dermatology, you need to look at all the diseases of the skin. You're going to have to look at the skin. You're going to have to know the different layers and where they are and things like that. So that's very, very important. You're doing anything related to those types of things. Neurology is the brain, obviously, but it's also the nerves as well. So you need to know your nerves. You need to know the brain. You need to know how all of these things work together, okay? So that's what's going to help you to learn those types of things. When you start researching, like the associations, particularly, like if you're coding for pulmonary, there's the American Lung Association. That helped me to learn my anatomy for the lungs, and it also helped to point me in the direction of like that they do these types of procedures when they're running like a pulmonary function test. Oh, okay. And so Googling a lot of those things really did help me. So I know it can help you. So whatever specialty it is, you can always find a really good specialty website. For orthopedics, it's orthoinfo.org is really good for orthopedic conditions. Like you can find any orthopedic condition. And so it's the same thing for like family practice. Family practice has theirs as well. So you can you can Google family practice and you'll see lots of different specialties about, not specialties, but you'll see a lot of different articles about coding for family practice. And so those types of things are designed to help you bookmark those websites, so that way in case you need to go back to their website to see something, referencing something or whatever, is going to be very helpful for you. So researching your anatomy is also really big, and with that comes those specialty websites, which will help you to really understand what you're doing. Okay, so that's all that part, right? That's all the really big big parts there. If your clinic hands out like durable medical equipment, it's a good idea to get with, if you are working in-house, which I know a lot of people are working remotely, but there's a lot of people that are working in-house. If you are working in-house, then you want to see if they have the boxes for any of the durable medical equipment. Like, for example, in the podiatry clinic, they have the boxes at the shoe, the shoe inserts that they come in, and on those boxes there's the HCPCS code. So if I have to report the HCPCS code, right, because it's coming from our clinic supply, it's right on the box. So there's no getting it wrong. It is specifically on the box. So a lot of times, like if you need to look up a HCPCS code for a specific item that's being distributed from that clinic, you can find out who the maker is, what the brand is, that kind of thing. If they don't have it on the box and they say it's, Insert Pro 3000, you know what I mean? Just some example, and then you say, what is a HCPCS code for Insert Pro 3000, and then hopefully it'll come up. If not, then you'll see whatever the results reveal, if there's a specific code for that. But you want to look to see if there's anything on hand that they're giving out, that if you have to report those HCPCS codes, that's the specific HCPCS code. And that's what I did when I found out that we were giving out those things in the clinic. I was like, okay, well, let me look at the item then. And I was able to get all of those. So when the provider documents it, I'm able to say, okay, well, here's that code for this and there's that code for that. So it makes your job a little bit easier when you can actually see things, okay? It's a good idea to get a visual as much as you can, okay? If you are working in the clinic, which I hope that you are, or if you are working remotely and your hospital is in the area, I highly encourage you to take some time to either book an appointment with a provider or somebody there, so that way you can meet the people. Because meeting the people that you're coding for is so critical. It is so, so critical, because sometimes these providers have never had a coder. And so if they've never had a coder, or they've never had somebody to be brave enough to introduce themselves, because providers will not reach out to you, okay? You need to reach out to them. And so letting your presence be known is helpful, because they are waiting for you to make the first move. They will not make the first move, because a lot of them don't want to be known as a provider that doesn't know, even though that's just ridiculous, because we're all on the same team. At least that's just what I say. But if you are in the area, or if you are working in-house, then you need to make sure that you introduce yourself. I'm your coder. I'm looking forward to working with you, and just be very direct in that way. You don't need to flower it up and say, oh, I hope your weekend was great and I hope everything is good. No. Just get to the point, because that's what they want from you and that's what you need from them. And getting to the point and conciseness is the exact place that we need to be, okay? And actually talking to them will help you to better understand what's going on in the documentation. Because if there's things that are missing in that documentation, and maybe you got assigned to this clinic because somebody else didn't want to deal with it, so they're putting it to the new person, or it's somebody that they feel they can handle it, it's okay to ask questions. It's okay to look things up, okay? But at the same time, you need to get right to the point, and you need to make yourself known. And so that way they know who to reach out to. And I know for some places they don't allow this, which I think is ridiculous, but I'm not everywhere, okay? But I'm just saying that some places they're like very against coders talking to their providers, which I think is a sad thing. Me, I would not work in a place like that. That's me, okay? But if you're there and somebody else does it and you're totally fine with it, whatever. Then I'm just talking to those people who are more in a position to be like, okay, well, what if I do speak up? What if I do offer that I'm available for questions? And even if you don't know something, you never say I don't know. You always say, let me do some research on that. I want to make sure that I get you the right information, and I'll get right back to you. And make sure that you get right back to them. Okay, if a provider comes to you with a question that you don't know, it is not the time to panic. This is the time for you to show, so that you can build that trust. Okay, show that you're there, you heard them, you're taking notes, and you're going to go look up that answer, and you're going to bring it right back to them, and you're not going to say I don't know. That's why providers don't talk to some coders, because they say things like that. I would never tell my provider I don't know, because that's, at that point, it's like saying that you don't care. You need to say it in a way, even if you don't know, that you're going to look it up, because it's a learning opportunity for both of you, right? So with that said, that is my advice on how to get started learning in a new clinic. Also, make sure that you reference your facility's specific guidelines about that specific specialty, because that will also help you. Sometimes, for me at my hospital, we have a manual that we have to adhere to in conjunction with the guidelines, and they do give us like coding examples and things like that, so to kind of help us to like understand like what we're doing. So it's always a good thing to review your facility's guidelines if they have any facility specific guidelines, and also to make sure that you understand the official coding guidelines for that particular specialty. Okay, don't skip over that part, because it's the people that skip over that part that don't know, and then they're running back and forth asking questions that people are going to get aggravated with that, because you should know how to look those things up. Okay, so I just told you guys, guidelines, practice the coding, look at the CPT manual, understand your modifiers, understand the evaluation and management levels. And if you don't understand evaluation and management levels, you need to do things proactively to learn about evaluation and management. It is not as scary as people make it out to be. Make sure that you get really good with the anatomy for that section, for that specialty. That is fantastic. Know where your resources are. So you research that particular specialty's major website, like if it's cardiology, of course, the American Heart Association. If it's pulmonology, the American Lung Association, and so on and so forth, okay? If it's ortho, orthoinfo.org, okay? So there's lots that you can do about that, okay? So I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Best of luck to you guys, and enjoy learning something new. Enjoy learning something about a new specialty, because trust me, it keeps everything interesting. With that said, I'm going to wrap this one up. Thank you guys for joining me. If this video helped you, please like, subscribe, and share, and I'll see you all next time. Bye.